नमस्कार, रेडियो पाठशालामा तपाईलाई स्वागत छ। रेडियो पाठशाला मकवानपुरको नमुना विद्यालय आधुनिक राष्ट्रिय माध्यमिक विद्यालय संघको सहकार्यमा रेडियो सन्देश 106.9 मेगाहर्जले तयार पारेको हो। तपाई रेडियो पाठशाला, रेडियो सन्देश 106.9 मेगाहर्ज, अनलाइनमा रेडियोसन्देश.com, मोबाइल एप्लिकेशनमा रेडियो सन्देश फेसबुक पेज र युट्युब च्यानलमा रेडियो सन्देश अनलाइन टिभीमा एकैसाथ सुनिरहनु भएको छ। आज रेडियो पाठशालामा सामाजिक विषय पढाउनको लागि आउनु भएको छ suraj बुdathoki। विद्यार्थी साथीहरू कपी कलम लिएर तयार रहनुहोला है।
Hello students, namaste, good morning. We are back again with another episode of Radio Pathshala. Welcome to you all. First of all, let's do a short recap. Alright, we talked about the infrastructures of development. I gave you one example to make you clear about the relation of development, prerequisites of development and infrastructures of development. I gave you one example of a bus. The bus is development and its wheels are infrastructures, and the force which is pushing the bus forward is prerequisites. So now you see, prerequisites is a kind of environment which helps the country to build the different infrastructures. And when the infrastructures of the country is strong, then there is good development, you can say. Alright. After that, we talked about the infrastructures and its definition. Then we started our first infrastructures of development, that is education. Today we are going to deal the third learning outcome of this unit, that is mention the status of health in Nepal. That is our lesson today. We are going to work on this learning outcome. Alright, so now let's move on. Okay students, now let's talk about health, another infrastructures of development. This is number 2. Health is a state of physical, mental and social well-being in which disease and infirmity are absent. This is a simple definition of health. What does this mean? This means that if you are free from disease or illness, if your physical and mental situation is okay or good, then you are healthy. Now you know the state of being free from illness or injury is called health. In the previous fiscal year, अघिल्लो आर्थिक वर्षमा, the budget for health was 68.78 billion rupees. But now there is 90.69 billion rupees allocated for health. Now you know the government has increased the budget for health. Why? Yes, you are right. It's because of the corona pandemic. Now let's talk about the importance of health. Before starting the importance of health, there is a saying that age is just a number. के भनिन्छ भन्दाखेरि चाहिँ उमेर एउटा अंक मात्रै हो. There is no age. Nobody can tell you that you are a child or you are a youth or you are an old person. It is just a number. This means that your age is not defined by that one simple number. It is defined by your action. How you think, how active are you, how you behave, how you interact with people. All these things defines your age. If you are active till your old age, then you are not old. You are active, you are running from morning to evening, you don't have any disease, you are healthy, then you are not old. So that is the real meaning. That is the real meaning of this saying. उमेर एउटा अंक मात्रै हो भनेर भनिन्छ. So now you know health is a factor which defines your age. To understand this better, you can take the example of Donald Trump, the President of America. He is now 74 years old. You can easily imagine how healthy he should be, how active he should be to run the most powerful country of the world. If he was sick, would it become possible for him to run the most powerful country in the world? Obviously no, right? Do you know or not, he became the president of America when he was 71 years old. Now he is 74 years old. What do you call him? He is 74 years old or he is 74 years young? So that's the matter. Health is the factor which defines your age. Alright? Another one. He who has health has hope, and he who has hope has everything. यसले पनि हेल्थको इम्पोर्टेन्स देखाउँछ हेर भाइ बहिनीहरु. He who has health has hope. जोसँग स्वास्थ्य छ उसँग चाहिँ आशा छ, होप छ. And he who has hope has everything. र जोसँग होप छ, आशा छ, उसँग सबै थोक छ. So the most important thing in your life is that you have to be healthy. You have to be active. When you are healthy, you are not burdened to your country. You are not burdened to other people. Your mind is fresh. You are free from disease. You can run for the betterment of your society. You can sweat for your people. बुझ्छौ sweat? पसिना बगाउनु sweat? Yes, W-E-A-T, sweat. You are able to sweat for your country. You are able to sweat for your people. Why? Because you are healthy. Alright? Health is the key to an active life, productive life. Alright? Just think, if you are sick, what happens then? You are in your bed. You need some other people to look after you. Now it has got two disadvantages. First disadvantage, you can't contribute for your country's development. Number one. And next, other healthy human resource have to look after you. Alright? So you can say it is the key to an active life and it is the key to a productive life. So you can say it helps to avoid unnecessary burden to the country. अनावश्यक रूपमा देशको लागि एउटा बोझ हुँदैन. When the country has got healthy human resource, the country can use that healthy human resource for utilizing the natural resources. Alright? Just look at the present situation. Our country has spent 10 arab rupees to fight the novel coronavirus. Alright? Next one. It can help to build other infrastructures of development. अघि मैले एजुकेसनको बारेमा पढाउँदाखेरि पनि यो भाइ बहिनीलाई भनिसकेको छु. यी सबै इन्फ्रास्ट्रक्चर्सहरु एकअर्कासँग अन्तरसम्बन्धित छन्, right? So when there is healthy human resource, there is positive effect in other infrastructures. If you are working to develop transportation sector, communication services, or you can say drinking water, in all these other infrastructures, healthy human resources is needed. Alright? A healthy person also lives a happy and prosperous life. अर्को एउटा फाइदा, when you are healthy, you can live a happy life. Is it true? Yes, you know about it. भाइ बहिनीहरूले पक्कै यसको बारेमा थाहा छ, हैन? जब आफ्नो घरमा, जब आफ्नो परिवारमा, जब कुनै समाजमा त्यहाँ कोही व्यक्ति बिरामी पर्छ, त्यसले एक किसिमको तनावको सिर्जना गर्छ. Now you can't imagine a happy life. Now you can't imagine a prosperous life. You have to spend time, you have to spend your energy, you have to spend money to take care of that sick person. So, you can say health is important to live a happy and prosperous life. You can also imagine a disease-free society. If there is health, then you can imagine a disease-free society. These are some importance of health. Also, there are different problems in health. You can see that in rural areas, we don't have enough health care services. People have to work hours to reach health post. There are some small health providing services. Health care facilities are very poor in our rural areas. Health postहरु त होलान् तर धेरै टाढा होला. दुर्गम क्षेत्रहरुमा मानिसहरुले घण्टौं लगाएर हिँडेर ती हेल्थ पोस्टहरुमा पुग्नुपर्छ. यसलाई हामीले के भन्न सक्छौं भन्दाखेरि चाहिँ there is lack of proper distribution of health care services. Especially it is in rural areas. In urban areas, there is no problem. There are lots of hospitals, nursing homes, medical institutions, which is providing standard health service. But in rural areas, there is problem. Another problem is the problem of health workers. And this is also found in rural areas. Mostly health workers are not willing to work in remote areas because there is lack of facilities for them. And the government is also making several provision by providing them allowance, by providing them opportunities, by providing them facilities. The government is trying to encourage the health workers to work in remote areas. Till now, this is also one problem. Poor presence of health workers in rural areas. Another one is inadequate supply of essential drugs. Drugs means medicine. औषधिहरू पनि पर्याप्त मात्रामा उपलब्ध छैनन् हाम्रो देशमा. And the drugs, or you can say medicine, which is available in our country, they are highly expensive. General people, or you can say normal people, can't afford to buy such medicine. And there are so many people in remote areas who die because of absence of simple medicine. गाउँघरतिर त अझै सामान्य औषधिहरू पनि बेलामा पुग्दैन र ती औषधिको कमीको कारणले गर्दा मानिसहरूले ज्यान गुमाउनु परेको छ. When you talk about the problem in health, you can also talk about lack of policy to deal with pandemic situation like this. अहिले यो अवस्थामा जुन अब हेल्थमा एउटा क्राइसिस आएको छ, स्वास्थ्यको क्षेत्रमा जुन एउटा समस्या आएको छ, यस्तो खालको समस्यालाई डिल गर्नको लागि चाहिँ नीतिहरूको पनि अभाव देखिन्छ. प्रपर प्लानिङ, प्रपर पोलिसी इज ल्याकिङ. अल राइट. जस्तो हामीले अहिले कुरा गर्यौं शिक्षामा, कोरोनाको कारणले गर्दा 90 लाख विद्यार्थीहरू घरमा बस्नु बाध्य छन्. अहिले तिनीहरूलाई स्कुलसम्म कसरी पुर्याउने, तिनीहरूको शिक्षालाई कसरी अगाडि बढाउने, तिनीहरूलाई विद्यालय शिक्षासँग कसरी जोड्ने भनेर एउटा नीति निर्माण गर्नलाई कति टाइम लाग्यो. त्यसै गरेर अब अहिले यो कोरोना महामारीको बेलामा चाहिँ सम्पूर्ण स्वास्थ्य क्षेत्र नै संकटमा परेको बेलामा कसरी स्वास्थ्य क्षेत्रलाई चाहिँ बढी भन्दा बढी उपयोगी बनाउने भन्ने राम्रो नीतिहरू, राम्रो योजनाहरूको कमीले गर्दा पनि स्वास्थ्य क्षेत्रमा चाहिँ धेरै किसिमका समस्याहरू देखिन्छ. Another one important problem in health you can talk about is poverty. Do you know poverty? Lack of money, right? You know, still 20% of our population is facing hand-to-mouth problems. That is the data of our country. 20% of the total population of our country is below the poverty line. They are facing hand-to-mouth problem every day. They go hungry every day. They can't think of a healthy food and hygienic life. Their main target is to survive, how to meet the hand-to-mouth problem. And because of this, there is malnutrition, कुपोषण, high child mortality rate, उच्च शिशु मृत्यु दर, and high maternal mortality rate, उच्च मातृ मृत्यु दर. Another one important problem in health you can talk about is unhealthy lifestyle. In the modern time, the lifestyle of the people is very unhealthy. They are very busy, but they lack physical work. Unhealthy lifestyle states two things. One is lack of physical work, and another one is consumption of alcohol and smoking. Unhealthy lifestyle ले दुईटा कुरो देखाउँछ भाइ बहिनीहरु. फर्स्ट, शारीरिक श्रमको कमी छ, नम्बर 1, र अर्को भनेको चाहिँ के हो भन्दाखेरि smoking and alcohol. That is the another reason. All right? These two things also is creating a kind of problem. If you can't sweat once in a week or twice in a week, it can surely create a kind of health problem to you. हप्तामा कम्तीमा 2 पटक वा 3 पटकसम्म पसिना बगाउन सकिएन भने, शारीरिक श्रम गर्न सकिएन भने त्यसले पनि हाम्रो हेल्थमा, हाम्रो स्वास्थ्यमा नकारात्मक असर पुर्याउँछ. Another problem in health we can talk about is contagious disease also. Sarua rog. Do you know contagious disease? Contagious disease are those disease which can transfer from one person to another person by the means of water, air, and other different things. So now students, in this way we discussed about the different problems in health. You can also note down. The first one is lack of proper distribution of health care service. We talked about it in number 1. Inadequate supply of essential drugs. Number 2. Lack of policy for pandemic situation. Number 3. Poor presence of health workers in rural areas. Number 4. Poverty, or you can say malnutrition, high child mortality rate, high maternal mortality rate. Number 5. And the unhealthy lifestyle of people. Number 6. Contagious disease. Number 7. These are the most important problems of health. Alright. You can also find different problems yourselves which are there in health. Alright. Now let's go on to the solution. How we can solve the problems in health. स्वास्थ्यमा भएका समस्याहरूलाई हामीले अब कसरी समाधान गर्ने त? You can find solution for this problem looking at the problem. Last time also I told you, if you are going to handle the problem, first of all, go through the problem once or twice. भाइ बहिनीहरूले त्यही प्रब्लमलाई नै, त्यो समस्यालाई नै एक दुई फेर यसो राम्रोसँग पढ्यो भने त्यसैमा त्यो समस्याको समाधानहरू पनि त्यसैमा भेटिन्छ. All right? For example, the government must give allowance, or you can say facilities, or you can say opportunities, different kinds of opportunities to health workers who are providing services in remote areas. Health workers like कसरी अब गाउँमा पुर्याउने भनेर उनीहरूलाई चाहिँ विभिन्न योजनाहरू बनाएर विभिन्न सुविधाहरू दिएर आकर्षित गर्न सकिन्छ. For example, poverty is causing malnutrition, poverty is causing high child mortality rate, poverty is causing high maternal mortality rate. Now how you can handle it? The answer is you have to improve the economic situation of the people. When the economic condition of the people is improved, all these things will be solved. And unhealthy lifestyle, there is another problem. And to deal unhealthy lifestyle, to deal the problem of unhealthy lifestyle, it's quite simple. You have to motivate the people about the healthy living style. You have to aware the people in school or in community using different means and resources. Either it can be mass media, very effective means to aware people about a hygienic lifestyle. स्वस्थ जीवनको बारेमा रेडियो, टिभी, पत्रपत्रिकाहरू, इन्टरनेटहरू प्रयोग गरेर पनि जनताहरूलाई सुसूचित गर्न सकिन्छ र एउटा स्वस्थ जीवन बाँच्नको लागि प्रेरित गर्न सकिन्छ. That can be a way to handle this problem, right? The country also has made health insurance policy, but a large group of our population is not aware about health insurance policy in our country. Sometimes I talk to my students in class and I ask them about health insurance policy, but they are not aware. They don't know about health insurance policy of our country. Now, the government must implement properly National Health Insurance Policy. National Health Insurance Policy must reach those remote areas where it is very, very necessary. स्वास्थ्य बीमा भन्ने जुन कार्यक्रम छ सरकारको, त्यो गाउँ घरमा पुग्न अति आवश्यक छ. सीमित व्यक्तिहरूलाई मात्र यसको बारेमा थाहा छ. If you have health insurance, then you can get facilities in medical treatment, right? So proper implementation of National Health Insurance Policy also can be another solution. Encouragement for health workers to provide services in remote areas also can be another solution. Health educations should be given not only in schools but also in community. That can be another solution. We talked about different problems. Now it is your duty, it is your homework for tomorrow to deal these problems in your own way. Alright? Okay students, in today's class we talked about health. After that we talked about the importance of health. After that, what are the problems in health and how we can handle such problems. All these things we did in our today's class. Alright? Now we know how to mention the status of health in Nepal. आज मैले भाइ बहिनीहरुलाई एउटा असाइनमेन्ट दिइरहेको छु हैन, होमवर्क दिइरहेको छु. Try to write down at least 4 importance. You can write also more, but at least 4 benefits of health. कम्तीमा पनि 4 वटा चाहिँ भाइ बहिनीहरुले लेखा है त. This is your homework. Okay students, this much for today. In the next class of Radio Pathshala, we will talk about another one important infrastructures of development, that is transportation. In our next episode, we are going to read about transportation. So if you have got time, go through your book, read the lesson transportation and be prepared. It will be helpful for you to understand the lesson. First of all, prepare notes on the lesson that we did today, that is health. And after that, if you get time, just read once the lesson transportation, at least once. Alright? Okay, that's all for today. Thank you. Be safe and keep your family safe. Bye-bye.
हस्त विद्यार्थी श्रोता, आजलाई रेडियो पाठशाला यति नै. रेडियो सुनेर साथ दिनु भएकोमा तपाईं सम्पूर्णलाई धेरै धेरै धन्यवाद. भोलि फेरि रेडियो पाठशालाको साथमा उपस्थित हुनेछौं. रेडियो पाठशाला तयार गर्न सहयोग गर्नुहुने विद्यालयका शिक्षक suraj बुdathokiलाई धन्यवाद र रेडियो सन्देश 106.9 मेगाहर्जका प्रविधिबाट सहयोग गर्नुहुने प्राविधिक साथी सुरेश गुरुङलाई धन्यवाद दिँदै आजको कार्यक्रमबाट सम्पूर्ण पाठशाला टिम बिदा हुन्छौं. नमस्कार.